work and responsibility should be rewarded by some measure of security and fair play, and an acknowledgement that sometimes government has to step in to help deliver on that promise. This has always been the history of our progress. In 1935, when over half of our seniors could not support themselves and millions had seen their savings wiped away, there were those who argued that Social Security would lead to socialism. But the men and women of Congress stood fast, and we are all the better for it. In 1965, when some argued that Medicare represented a government takeover of health care, members of Congress, Democrats and Republicans, did not back down. They joined together so that all of us could enter our golden years with some basic peace of mind. You see, our predecessors understood that government could not and should not solve every problem. They understood that there are instances when the gains in security from government action are not worth the added constraints on our freedom. But they also understood that the danger of too much government is matched by the perils of too little. That without the leavening hand of wise policy, markets can crash, monopolies can stifle competition, the vulnerable can be exploited. And they knew that when any government measure, no matter how carefully crafted or beneficial, is subject to scorn, when any efforts to help people in need are attacked as un-American, when facts and reason are thrown overboard and only timidity passes for wisdom, and we can no longer even engage in a civil conversation with each other over the things that truly matter, that at that point we don't merely lose our capacity to solve big challenges. We lose something essential about ourselves. That was true then. It remains true today. I understand how difficult this health care debate has been. I know that many in this country are deeply skeptical that government is looking out for them. I understand that the politically safe move would be to kick the can further down the road, to defer reform one more year, or one more election, or one more term. But that is not what this moment calls for. That's not what we came here to do. We did not come to fear the future. We came here to shape it. I still believe we can act, even when it's hard. I still believe that we can act when it's hard. I still believe we can replace acrimony with civility and gridlock with progress. I still believe we can do great things, and that here and now we will meet history's test, because that's who we are. That is our calling. That is our character. Thank you. God bless you, and may God bless the United States of America. Thank you.
The President of the United States, Barack Obama, speaking before a joint session of Congress on plans and proposals to implement health care and health care reform. That is the topic tonight, as you can see there. The President concluding his remarks before a full session of Congress with Vice President Joe Biden. Representative Nancy Pelosi also attended a guest, Michelle Obama, the First Lady, sitting next to Ted Kennedy's widow, Vicki Kennedy. Let me bring in Bloomberg's Lizzie O'Leary, who's been standing by and watching the speech in Washington. Lizzie, what did you make of the speech? I mean, it seems as though invoking the image and a letter that Senator Ted Kennedy had posted to President Barack Obama to be opened only upon the death of the senator, an added flourish at the end of the speech.
Absolutely, an incredibly emotional one, because one of the things, obviously, Pim, that we've talked about in covering Senator Kennedy's death was his ability to reach across the aisle in crafting legislation and his very close friendships with a lot of Republicans, several of whom President Obama cited by name: Orrin Hatch, John McCain. And one of the things you heard the president try to do in this speech was borrow a few ideas from Republicans, notably John McCain. You heard that idea about having high-risk pools for folks who might otherwise be denied coverage. That was something that John McCain talked about on the campaign trail. So weaving in both the sort of poetry of recalling Senator Kennedy, but also the practical politics and policy that has been espoused by Republican members was something that the White House very much intended to do. They know they've got to get this fight back on a bipartisan basis. But this was, I think, by any measure, a very strong speech in terms of the strong language used and the passion behind it, not just from the president, but at one point we heard someone from the floor, and I believe it was a member, shout back at the president, Pim.
Lizzie, we have a guest. We've got John Castellani. He is the president of the Business Roundtable. It provides health care coverage to over 35 million Americans. John Castellani, welcome to the program. You listened to the president's speech. What is your reaction to it?
Well, we certainly support the president's leadership in trying to find a way with Congress to bring health care reform. Health care reform for our companies, you mentioned the 35 million Americans, more than that we provide health insurance for, is both a personal necessity and an economic imperative. We need the kinds of reforms that will help get control of the costs and increase high-quality available health insurance for everybody. So we support his efforts to find that bipartisan solution.
Do you support the efforts for the public exchange? The president speaking that he would entertain any kind of proposal, even a co-op, that would provide some kind of insurance exchange for people that cannot get affordable health care. Is that something that you would support?
Well, the exchange idea is something that we have supported. It is part of what we see as important in insurance market reforms. We think the keys to health care reform are, first, reform the delivery system. Make sure that we're paying for good quality outcomes, that we're using the best information technology, that we're emphasizing wellness and prevention as much as treatment. Secondly, reform the insurance market so there is real competition. And including in those reforms, have the kinds of exchanges that allow individuals and small businesses into the program in an affordable way. And
all right,
third,
John Castellani, just hang on 1 second. Let's go to the Republican response to the president's speech. We're listening to Representative Charles Bustami of Louisiana.
It's clear the American people want health care reform, but they want their elected leaders to get it right. Most Americans wanted to hear the president tell Speaker Pelosi, Majority Leader Reid, and the rest of the Congress that it's time to start over on a common-sense, bipartisan plan focused on lowering the cost of health care while improving quality. That's what I've heard over the past several months in talking to thousands of my constituents. Replacing your family's current health care with government-run health care is not the answer. In fact, it'll make health care much more expensive. That's not just my personal diagnosis as a doctor or a Republican. It's the conclusion of the nonpartisan Congressional Budget Office, the neutral scorekeeper that determines the cost of major bills. I read the bill Democrats passed through committee in July. It creates 53 new government bureaucracies, adds hundreds of billions to our national debt, and raises taxes on job creators by $600 billion. And it cuts Medicare by $500 billion while doing virtually nothing to make the program better for our seniors. The president had a chance tonight to take the government-run health care off the table. Unfortunately, he didn't do it. We can do better with a targeted approach that tackles the biggest problems. Here are four important areas where we can agree right now. One, all individuals should have access to coverage, regardless of pre-existing conditions. Two, individuals, small businesses, and other groups should be able to join together to get health insurance at lower prices, the same way large businesses and labor unions do. Three, we can provide assistance to those who still cannot access a doctor. And four, insurers should be able to offer incentives for wellness care and prevention. That's something particularly important to me. I operated on too many people who could have avoided surgery if they'd simply made healthier choices earlier in life. We do have ideas the president hasn't agreed with. We're grateful the president mentioned medical liability reform, and we hope he's serious. We need to establish tough liability reform standards, encourage speedy resolution of claims, and deter junk lawsuits that drive up the cost of care. Real reform must do this. Let's also talk about letting families and businesses buy insurance across state lines. I and many other Republicans believe that that will provide real choice and competition to lower the cost of health insurance. Unfortunately, the president disagrees. You can read more about all of these reforms at healthcare.gop.gov. These are common sense reforms that we can achieve right now without destroying jobs, exploding the deficit, rationing care, or taking away the freedoms American families cherish. This Congress can pass meaningful reform soon to reduce some of the fear and anxiety families are feeling in these very difficult times. Working together in a bipartisan way, we can truly lower the cost of health care while improving quality for the American people. I'm Dr. Charles Bustani. Thank you for listening.
You've been listening to Representative Charles Bustani, Republican of Louisiana, offering the Republican response to President Barack Obama's speech before a joint session of Congress. We have with us John Castellani. He is the president of the Business Roundtable, and we're joined also by Lizzie O'Leary, Bloomberg's expert, coming to us from Washington. Lizzie, in listening to this speech, the president spoke about the deficit. He spoke about how that this plan would not cost any more money, that the savings that would be achieved in various types of reform and in waste management, that they would actually pay for the health care proposals. Is that likely to meet with any opposition?
Well, it's certainly, I think, a key test for garnering any type of bipartisan support for this. The president and the White House have said they want this bill to be, in Washington speak, deficit neutral. But you certainly heard a pretty strong defense of that from the president today, saying that they would look for places to cut first before extra places to spend, that would be actually a feature in the bill. So that's certainly an important thing. At one point, the camera flashed to some of the members of the Budget Committee, and you could see them nodding and going along with that, because otherwise, without some significant cost controls, not only will the president maybe lose some potential Republican support, but certainly moderate Democrats as well, who have expressed some concerns about some of the price tags of these congressional bills that we've seen. There's one thing, Pim, I want to throw back to you and to John Castellani, because we did hear the president say that Americans should be required to have insurance, and that employers, a lot of employers, would be required to provide it, offer it. Now, I'm curious how that will impact the members of the Business Roundtable. I'd be curious to hear what John has to say about that.
Go ahead, John Castellani.
Lizzie, it's a good point. We absolutely agree that the only way the system is going to work is to get everybody in it. And we think the best approach is to have an individual requirement, an individual obligation, such as what the president has proposed. For the members of the Business Roundtable, requiring that companies provide it is really an academic issue, because all of our companies do provide health insurance for their employees. The key is making sure that we can bend the cost curve, that we can eliminate the kinds of cross-subsidies, the cost shifting that we bear now as payers, so that we can continue to provide that health insurance for our employees and their families.
John Castellani, if indeed there is a lot of waste in this system and it's going to be wrung out in order to pay for this new health care reform, why wouldn't you just wring the cost out anyway? It just isn't that good business?
Well, one of the problems that we have is we've tried to be very innovative, and in fact, many of our companies are very innovative. You see weight control programs, management for type 2 diabetes, healthy activities, smoking cessation programs. But our problem is we've got another big player in the system called Medicare, which can't be innovative, which isn't innovative, which has a fee-for-service type structure rather than an outcome structure, which can't focus as well on wellness and prevention. And so we have this big 900-pound gorilla called Medicare that's in the system, and providers who we go to and say we want to be innovative say, I'd like to, but Medicare won't let us, and they're a big portion of our income. So we've got to get Medicare to be innovative if we're going to be successful.
Lizzie O'Leary, you know how the games in Washington are played. Is this opening the door for another round of negotiations? The president even made mention saying that his door is open, but not open for people that just want to kill this reform plan.
Well, it's absolutely open for a whole host of negotiations. There is a deadline that I would like to remind people of that we've forgotten a little bit, and that's October 15th. And it's not something that we talk about a lot, but that is the deadline by budget process, whereupon the Senate will have to decide if they're going to do something called budget reconciliation. That's a different way of moving a piece of legislation, which would only require a majority vote threshold. It doesn't require 60 votes in the Senate. It sounds academic, but it's not. I'm sure John can tell you as a longtime D.C. watcher that if the White House and the Senate Democrats can't get enough Republican support by October 15th, it's written into law, they would have to move alone on a reconciliation bill. So you're going to have, I think, a pretty aggressive period of negotiation between now and then to try to figure out what happens. Certainly, we know the Senate Finance Committee is going to move with their bill shortly. And then, well, there's a lot of talk kind of right up until the moment anything hits the floor.
Now, Lizzie and John, the idea of talk and the idea of bickering, sometimes they are very close together in Washington. Let's listen to what the president had to say about bickering over health care reform.
The time for bickering is over. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care.
Lizzie O'Leary, how important is it for the Congress to deliver on health care during this session?
Well, I think it's important for that to happen, but it's also very important politically for the president to come out and make that case, because that voice you heard and the kind of passion behind it was not something you were hearing in the months of August. You heard a lot of other voices. Certainly, they were very passionate at these town halls. You had different members talking about it, different constituencies talking about it. But the point there was for the president to put the onus back on Congress and try to light a little bit of a fire and also say what he would accept and what he wouldn't accept. Another question, if I could throw it to John, that I'm curious about is the tone on insurance companies in general. You have a lot of insurance company members. Ron Williams from Aetna, certainly one of your members. This seemed to be a pretty aggressive speech, not just about the partisan quality, but also going after the insurance industry. Is there a fine line there in terms of keeping business support and alienation?
Well, you know, we look at this from the standpoint of payers and providers of health insurance. But it's interesting, almost, in fact, just about everything, if not everything, that the president said tonight that he wanted from the insurance companies, the insurance industry has already brought forward and said, we're willing to do this. We're eager to do it. But in order to be able to make it effective, we need the kind of market reforms that allow us to have access to all of the markets. You know, it's interesting, if big companies like our members, they've got a choice between 10, 12, 15 different insurance companies. But as the president said, you go into some states and it's only 1 or 2 or 3 or 4. We think, and the insurance companies think, that this can work better if American consumers, American individuals, American small businesses have the kinds of choices that big businesses have, and as the president mentioned, the government has. And that is among 10, 12, 15 companies competing on quality and on cost, on deliverability, on customer service. That's why we get the best for our employees, and we think that'll work for the nation. That's why we think that insurance reform will solve the problem that others seem to think should be solved by the so-called public option, which presents us with a lot of problems.
All right, I want to thank you both. I want to thank you, John Castellani, the president of the Business Roundtable, speaking about President Barack Obama's health care reform speech before a joint session of Congress. And, of course, our expert in all things Washington-related, Lizzie O'Leary, coming to us from the Capitol. Thank you for joining us for this historic speech on health care reform from President Barack Obama before a joint session of Congress.